Welcome again to the medical imaging anatomy course and the second section, the imaging anatomy of head and neck. In the previous lecture, we talked about the skull, including the calvarium and the skull base, and we talked about the paranasal sinuses. Today we'll be talking about the facial skeleton. The facial skeleton consists of 14 bones and the hyoid bone under the lower jaw. They can be divided as well, same as we divided the skull bones, into two groups, the paired and unpaired facial bones. The paired ones are the ones they are found in pairs, bilateral and symmetrical, including the lacrimal bones, which form the anterior and medial wall of the orbit. Today we'll be talking about the orbit and its contents, and we'll talk about these bones as well. The nasal bones, the zygomatic bones, the maxilla, the palatines, the inferior nasal concave. The unpaired facial bones include the midline vomer, the mandible, and the hyoid bone below the lower jaw. So here let's take a look at this figure. We already talked about the bones that form the skull. So today we'll be focusing on the bones that form the facial skeleton, that forms our face, the shape and size of our faces. And we first will leave the orbit. Later on we'll talk about the orbit, including the bony orbit and its contents. And here let's talk about the other bones that form the face. The zygomatic bone on either side. The maxillae, we have two maxillae, one on the left side and one on the right side. They join at the midline. This is the mandible, forming the lower jaw, while the maxillae are forming the upper jaw. And we have the nasal bones here, forming the superior and outer surface of the nose. This is a lateral view of our skull. This is the nasal bone, the maxilla, zygomatic bone, and the mandible. This is the temporomandibular joint. Later on, we'll talk about the mandible and the temporomandibular joint and its specific and detailed structures. Here, let's talk about some important structures of the internal facial skeleton, including first the nasolacrimal canal. But before I talk about the nasolacrimal canal, there is a phenomenon which we all know, which is when we cry, we start to feel that we are having a runny nose, right? Why is this phenomenon happening?
Because the nasolacrimal duct drains through the nasal meatus.
Or the nasolacrimal canal or duct, as you said, it drains the lacrimal fluid or the tear from the eye to the nose, right? Normally we don't feel it because it's very minimal and it goes posteriorly. But when we are crying or there is any stimulation to the lacrimal gland and there is over secretion of tears, the tear then split on our faces from the anterior surface of the eye, and it also go through the anterior opening of the nasal cavity instead of going all posteriorly. So nasolacrimal canal is the canal that is located on the medial corner of our eyes, and it's connecting this portion of the eye to the posterior area of the inferior nasal concha, draining the lacrimal fluid or tears. Another structure to talk about is the inferior nasal concave. The inferior nasal concave is one of three pairs of nasal concave. It's the most lower one and the most prominent one. It projects into the nasal cavity. So when we examine the nose, we can see this projection within the nasal cavity. Another structure is the vomer bone. The vomer bone is a single midline bone. It forms the inferior portion of the nasal septum. Here let's have a look at the nasal cavity. The nasal cavity is formed by all of these bones. The frontal bone superiorly and the nasal bone superior anterior. The ethmoid bone including the perpendicular plate, which forms the superior portion of the nasal septum. The sphenoid bone, and we know that the sphenoid sinus is found just posterior to the nasal cavity. The vomer bone, which is this bone, it's a single midline bone. It's forming the inferior portion of the nasal septum. The third structure that contribute to the nasal septum is the septal cartilage, which forms the most anterior portion of the nasal septum. The palatine process of maxilla and the palatine bones provide the floor of the nasal cavity. So this is the nasal cavity and the structures that forms it. We move on to talk about the maxilla. The maxilla forms the upper jaw, much of the hard palate, the medial floor of the orbit, and the lateral base of the nose. So it contributes to the formation of all of these structures. The alveolar process of maxilla is the curved inferior margin of the maxillary bone that forms the upper jaw, and it contains the upper teeth. There are small sockets that's called alveolus, which houses the tooth. And the infraorbital foramen, this is a small foramen that provides an exit for sensory nerve that supplies the nose, the upper lip, and anterior cheek. The palatine process of the maxilla can be seen joining together at the midline. So we have two maxillae. Each one has a palatine process. These two palatine processes join at the midline to form the anterior three quarters of the hard palate. Then the posterior quarter of the hard palate is formed by the palatine bone. So the hard palate is the bony plate that forms the roof of the mouth and floor of the nasal cavity, separating the oral cavity from the nasal cavity. This is an isolated maxilla diagram to show these small structures of the maxilla. So this projection is the projection that articulates with the frontal bone. This flat area is the floor of orbit, and this is the zygomatic process, which will articulate with the zygomatic bone. This is the infraorbital foramen, which is an exit for several sensory nerves. And this is the alveolar process, including these alveolus, which are these small sockets that contain the upper teeth. We move on to talk about the mandible. The mandible forms the lower jaw, and this is the only movable bone of the skull. At the time of birth, the mandible consists of paired right and left halves. Then, by the first year of age, these two halves fuse together to form a single U-shaped bony structure, which is the mandible. So in adults, it's fused. It also has alveolar process, which provides sockets for housing the lower teeth. A small protuberance is found at the most inferior portion of the mandible, which is called the chin or mental protuberance. Mental foramen is a small foramen that is the exit site for a sensory nerve that supplies the chin. There is also another foramen on the medial side of the mandible. It's called the mandibular foramen. This mandibular foramen leads into a tunnel in which the sensory nerve and blood vessels that supply the lower teeth pass through. Therefore, when dentists do some dental work, they need to numb the teeth, right? So what they do is that they inject anesthesia into the lateral wall of the oral cavity, where there is the opening of mandibular foramen. So they numb the afferent nerves, which are going from the tooth through this opening. The lingula is a small flap of mandible. It's found on the inner side, on the medial side, and it is a site for temporomandibular joint sphenomandibular ligament attachment. When we talk about temporomandibular joint, we will see this ligament. This is an isolated mandible which is fused in adults. This is the body of mandible, and this is the ramus. It has these two projections. The anterior one is the condylar process, and the posterior one is mandibular condyle, which articulate with the temporal bone, forming the temporomandibular joint. This notch between these two projections is the mandibular notch. This is the chin, or the mental protuberance, and this is the mental foramen, which is the passageway for the nerves that supplies the chin. On the inner side, there is the mandibular foramen that we talked about, the lingula, which is a small flap of mandible that provides attachment to the ligament of temporomandibular joint, and the mylohyoid line, which is another attachment for the suprahyoid muscles. This is the temporomandibular joint on the living skull. So here we will have a series of images, including X-rays, CTs, and MRI images of different planes. So we review all we learned about the skull and facial skeleton. Let's start with this image, which is a lateral projection of the skull. We can see the most anterior portion of the skull, which is the frontal bone. This is the location of coronal suture, which connects the frontal bone with the posteriorly located parietal bones. This is the outer table of the skull, the diploic space, and the inner table. These hypodense lines are grooves within the inner surface of the skull. These are the grooves of the meningeal vessels. This is the location of lambdoid suture, which connects the parietal bone with the occipital bone. This is the sella turcica, which is the house of pituitary gland. It includes this small projection, which is the anterior clinoid process and posterior clinoid process. Just inferior to the sella turcica and anterior is the sphenoid sinus. This is the clivus. This hypodense round structure here is the external acoustic meatus. And this is the mastoid air cells. Later on, we will talk about the air and the surrounding structures, and we'll talk about this part. Regarding the facial skeleton, this is the maxilla, and this is the mandible. The temporomandibular joint is here. Later on, we'll have more clear images for the temporomandibular joint. This is the posterior anterior projection of the skull, in which the X-ray beam is coming from the posterior part of the skull going to the anterior, where the radiographic table is placed. So here we can see this hypodense area is the frontal sinus within the frontal bone. This is the location of ethmoid bone. This is crista galli, the cribriform plates. This is the location of ethmoid air cells on either side of the ethmoid bone. This is the nasal septum. The superior portion is formed by the perpendicular plate that's projecting inferiorly from the ethmoid bone, right? And inferiorly it's formed by the vomer. Yes. This is the middle turbinate or middle concha, and this is the inferior turbinate. This is the maxillary antrum or maxillary sinus. This is the maxilla, and this is the mandible. This is an occipital projection, the caudal view. This view is better for the evaluation of frontal sinuses. This is the direction of X-ray beam. The difference between this projection and the previous projection, that in this projection the head is extended slightly to form approximately 20 degrees with the radiographic plate. Here we can see the frontal sinus. This is the temporal surface of the greater wing of sphenoid, and this is the lesser wing. This hypodense area is the superior orbital fissure. When we talked about the foramen of skull base, we talked about this structure. And we will see it again when we talk about the orbit. Here we have the foramen rotundum. This is the maxillary sinus. And these are the zygomatic bones. This is a fronto-occipital projection, or it's called Townes view. In this projection, the X-ray beam is going from the occipital bone to the frontal bone directly. This view is better for evaluating the cranial cavity and the occipital bone. So when there is suspicion of occipital bone fracture, this view is preferred because it avoids the overlap of the occipital bone with the facial skeleton. Here we see the sagittal suture. This is the occipital protuberance, the lambdoid suture on either side, occipital crest. This is the occipital bone, and this is the foramen magnum. This is the posterior arch of C1, cervical vertebral number 1, and this is the zygomatic arch. This is a submentovertical projection. Sometimes it's called an axial projection because the X-ray beam is going from down up, imaging the whole head as if it is taking an axial image. This is better to show the base of skull than the paranasal sinuses. This is the zygomatic bone, and this is the maxillary sinus. This structure is the nasal septum. Superiorly, it is formed by the perpendicular plate of ethmoid bone, and inferiorly by the vomer. This is the greater wing of sphenoid bone. These small round and oval shaped structures are the skull base foramina. This is the anterior arch of the atlas, and this is the dens of the axis. This is an orbitomeatal projection, or it's called Waters view. In this view, the head is positioned in this way, so the orbitomeatal line, which is the line passing through the orbit to the external meatus, forming a 45-degree with the radiographic plate, and then the X-ray beam is coming from posterior to anterior. This is a good view for showing the paranasal sinuses. As you see here, the 4 groups of paranasal sinuses are seen clearly. This is the frontal sinus. This is the maxillary sinus. Posteriorly is the sphenoid sinus, which is posterior to the nasal cavity. And these are the ethmoid air cells on either side of ethmoid bone. Here we can also notice the nasal bones, nasal septum, maxilla, and mandible. Here we start to see a series of CT images in axial, sagittal, and coronal views. Let's start with the axial view, a whole series from top to the lower jaw. So this is the most cephalic section that we have here. Anteriorly is the frontal bone, and here is the coronal suture, parietal bone, lambdoid suture. We see it just as a thin hypodense line, and this is the occipital protuberance, the internal occipital protuberance. This is the occipital bone. More caudal section. Here the internal occipital protuberance is seen more clear. This is the mastoid air cells. This is the dorsum celli, which is the dorsal surface of the sella turcica. This is the orbital surface of frontal bone. As we said, that frontal bone is one of the bones that form the bony orbit. So this is the plane that forms the superior surface of the bony orbit, and this is the frontal sinus. By the way, these are all bone window CT images, which means that here we just see the bone structures. We cannot see the soft tissue structures within the cranium. More caudally, here we can see the superior orbital fissure, anterior clinoid process of the sella turcica, dorsum sellae. This is the internal acoustic meatus, which is the passageway of facial nerve and vestibulocochlear nerve. This is the lambdoid suture, occipital bone. More caudally, here we can see the ethmoid air cells on either side of the ethmoid bone. This is the greater wing of sphenoid. This is the temporal fossa. This is the sphenoid sinus posterior to the nasal cavity. This flat portion of the temporal bone is called the squamous portion or squamous part of temporal bone. And this is the external acoustic meatus. This is mastoid air cells, lambdoid suture, and occipital bone posteriorly. More caudally, here we can see the foramen rotundum, the foramen ovale, and foramen spinosum, from anterior to posterior. Rotundum, ovale, and spinosum. I use the word rows, R for rotundum, O for ovale, and S for spinosum. And then more posteriorly, we can see the carotid canal. I think carotid canal is more clear. And if you have the soft tissue window, you will see the internal carotid artery passing through. More posteriorly is the jugular foramen, and foramen magnum is the largest of all. This is the passageway of spinal cord. This is the occipito-mastoid suture, the suture between occipitus and mastoid portion of temporal bone. More caudally, here we can see the nasal septum. This is the perpendicular plate of ethmoid bone that forms the superior portion of the nasal septum. This is the inferior orbital fissure. Don't worry if you confuse some of the structures, because here we're just having an image, but in the real medical imaging life you will have a series. So if you don't know if this is superior or inferior, you just move up and down and you will see what is superior and what is inferior. This is the sphenoid sinus, and this is the clivus. This is petrooccipital fissure. This is the hypoglossal canal, which is the passageway for the hypoglossal nerve. This is the carotid canal, and this is the jugular foramen or jugular fossa. Foramen ovale, foramen spinosum. More caudally, nasal septum, ethmoid air cells, nasal bones, zygomatic bones, sphenoid sinus, clivus. These are the occipital condyles. And this is the posterior arch of atlas. Here we are starting to see the cervical spine. On this section we can see the nasolacrimal duct. This duct, which drains the lacrimal fluid from the eye to the nose. This is the coronoid process of mandible, which is the anterior projection of mandibular ramus. This is the neck of mandible. This is the styloid process of temporal bone. Here, this is the dens of axis, and this is the anterior portion of the atlas. Here we start to see the vomer, which is the inferior portion of the nasal septum. This is the inferior nasal concha, the frontal process of the maxilla, lateral wall of maxillary sinus. This is the maxillary sinus. This is the ramus of mandible. This is the styloid process, and this is the cervical vertebral body. More down, this is the anterior nasal spine of maxilla, and this foramen or canal is called the incisive canal. This is the alveolar rim of the maxilla. This is the mandibular canal, the ramus of mandible, and cervical vertebral body. Here we start to see a series of coronal CT images, bone window as well. So this one is more anterior. So here we can see the frontal bone. This area is the frontozygomatic fissure, the fissure that connects the frontal bone to the zygomatic bone. This is the zygomatic bone. Infraorbital foramen, vomer of the nasal septum. This is the inferior nasal concha, the maxilla, and teeth. At the midline here is sagittal suture, parietal bones on either side, the lesser wing of sphenoid bone, the perpendicular plate of ethmoid bone, which forms the superior portion of the nasal septum, the zygomatic bone, the hard palate, and the alveolar process of the maxilla. More posteriorly, here we can see the anterior clinoid process of sella turcica. These are the greater wings of sphenoid bone, inferior orbital fissure, zygomatic bone, just a section, alveolar process of maxilla, and this is the body of mandible. Here we can see the posterior clinoid process because this section is more posteriorly, and the dorsum cella. The greater wings of sphenoid bone, nasopharynx, zygomatic bone, coronoid process of the mandible. This is the zygomatic process, foramen ovale. This is a part of pterygoid process, and this is the ramus of mandible. More posteriorly here we can see the temporomandibular joint. So this is the head of mandible, and this is the neck. Both are called the condylar process of mandible or mandibular condyle, which are with mandibular fossa form the temporomandibular joint. This is the carotid canal, and this is the clivus. At this portion is the petrooccipital suture. More posteriorly, this calcified structure within the brain is the pineal gland. So this is a normal physiologic change of the pineal gland. If you want to ensure, you just adjust to the soft tissue window and you ensure that that is the location of pineal gland. This is the petrooccipital suture. This is the internal acoustic meatus, styloid process of temporal bone, ramus of mandible. This is the jugular fossa, and this is the hypoglossal canal. Here we can see the occipital condyle and the anterior arch of C1. So we can see here the joint between the occipitus and the cervical spine. This is the dens of the axis. This is the body of the atlas, and this is the occipital condyle. So this is the atlanto-occipital joint. This is the location of hypoglossal canal, and these are the mastoid air cells, ramus of mandible, and styloid process. This is more posteriorly. So here we start to see the occipital bone. This is a portion of occipital bone. This is foramen magnum, in which the spinal cord is passing. This is the tip of mastoid process, sagittal suture, and parietal bones on either side. Here we start to see a sagittal images. Anteriorly is the frontal bone. At the top is the parietal. Between them is the coronal suture. Posteriorly is the occipital bone. Here, this is the frontal sinus. This flat bone structure is the cribriform plate of the ethmoid bone. and this is the sphenoid sinus. This is the anterior clinoid process and posterior clinoid process. This is the sella turcica. Here we have the clivus. At the lower edge of clivus is the anterior edge of foramen magnum. This is the foramen magnum. So this is the anterior edge and this is the posterior edge. The anterior edge is formed by the inferior end of the clivus. It's called the bastion. And the posterior edge is formed by the lower end of the occipitus, which is called opistheal. So when we want to evaluate the foramen magnum, we usually draw a line between bastion and opistheal. So it's called bastion-opistheal line. This is the horizontal plate of palatine bone, and this is the palatine process of maxilla. So these two structures together form the hard palate. This is the nasal bone, and this is the alveolar process of maxilla. Here we can see the superior orbital fissure start to show up. Pterygomaxillary fissure between the pterygoid plate and the maxilla. This is the maxilla, and this is a section of mandible. This is the greater wing of the sphenoid bone. This is foramen ovale, and this is the jugular foramen. This is the petrous part of the temporal bone, and this is the orbital plate of the frontal bone, which forms the superior surface of the orbit. This small, tiny foramen is the foramen spinosum. This is the petrous bone. This is the carotid canal, and this is the jugular foramen. Anteriorly is the carotid, and posteriorly is the jugular. Here we start to see 3D reconstructed images. At the top is the parietal bone, as we know. Anteriorly is the frontal. Yeah. This is the coronal suture. Yeah. And posteriorly is the lambdoid suture, the occipital bone. This is the zygomatic bone and zygomatic arch. This opening here is the external acoustic meatus. This is the mastoid process, and this is the styloid process of the temporal bone. So by 3D images, we can see the skull very clearly, as if we are looking at a living skull. This is another image. Here we can see the anterior nasal spine, the maxilla and mandible. This is the temporomandibular joint, temporal fossa, and this projection is the head of condylar process of mandible or mandibular condyle. This is the alveolar process of mandible. This is an anterior view, 3D reconstructed image. Frontal bone, glabella of the frontal bone. Here we can see the orbit. This is the nasal bones and the nasal septum. This is the anterior spine of the anterior nasal spine, this small bony projection. And this is the alveolar process of the maxilla. This is the body of mandible, and this is the ramus. And this is the mental foramen. This is a superior view. You can see parietal foramen for emissary veins. This is a small vein that drains the scalp to the superior sagittal sinus. See the sagittal suture, lambdoid suture, parietal bones, and occipital bone. Here we can see a part of the ramus of mandible. This is a sagittal section, 3D reconstructed. So here we can see the parietal, and these are the groups that we talked about previously. Sella turcica, clivus, sphenoidal sinus, and here we can see the inner part of the mandible. This is the submandibular fossa, mylohyoid groove or mylohyoid line, and this is the angle of mandible, which contribute to the shape of our face. here is the largest opening, which is the foramen magnum. Now this is the occipital bone. This is a coronal section, 3D reconstructed. So this is the occipital bone. This groove is the groove of superior sagittal sinus, and here is the groove for transverse sinuses. Down here is the groove for sigmoid sinuses, and this is the foramen magnum. This is for anterior part. So here we can see the frontal bone, the frontal crest, the optic canal, and this is the superior orbital fissure. These are the greater wings of the sphenoid bone, and this is the lesser wings. This is the petrous part of the temporal bone, and this is the internal acoustic meatus, jugular foramen. This is the groove for sigmoid sinus, and this is the odontoid process or the dens. This is the hypoglossal canal. This is inferior view looking at the top of the skull. So this is the frontal bone, frontal crest. This is the location of coronal suture. And these small structures are small depressions for the arachnoid granulations. Here we can see the parietal bones on either side, and posteriorly is the occipital bone. This is the location of lambdoid suture. Because this section is very high, so we can just see a small portion of the occipital bone. This is an inferior view of the skull base. So here we can see the frontal sinus, crista galli of ethmoid, the lesser wing of the sphenoid bone, the anterior clinoid process, and the pituitary fossa. This is foramen ovale, foramen spinosum, the clivus, which is this sloping bony structure that forms the anterior surface of the brainstem, hypoglossal canal, and the occipital bone. Here we can see the groove of sigmoid sinus, the petrous, the foramen lacerum, the optic canal, foramen rotundum, and this is the foramen ovale and the foramen spinosum, and this is the superior surface of orbital part of the frontal bone. Sorry.
There's another cut where we saw the carotid canal medial to the foramen ovale and foramen spinosum, and here we see the foramen lacerum. Are they related, the lacerum and the carotid canal?
They are not very related, but they are very near. Yeah. I think here, if we are looking at the canal, this is a carotid canal. Yeah. But foramen lacerum is very near to this structure.
Okay. Oh, yeah.
Yeah. Because foramen, as we said previously, foramen lacerum is an opening, but it has nothing to pass through. It's obscured by fibrous tissue. So even if you don't know it, it's okay. Yeah. But you have to know the foramen, the carotid canal. This is inferior view, including the mandible and a part of cervical spine. So here we can see the occipital bone, the inferior knuckle line, superior knuckle line. Here we can see superior is more lower than inferior, right? Because this is reversed position. This is the external occipital protuberance. This is the carotid canal, foramen ovale, condylar process of the mandible, and this is the zygomatic arch. This is the body of mandible, U-shaped, and this is the hard palate. Here we look at MR images of the skull. We will not see that much about MRI, but we need to compare these structures that we have seen on CT how they look like on MRI, because the anatomy will not change, the location will not change. What will change is the brightness. We name this brightness on CT density or attenuation. On MRI we call it signal. Yeah. Let's have a look at these two images. I put them together. This is CT, bony window, and this is MRI, T1 MRI. Let's compare these two images. What we can see here is the mandible, right? The more dense area of the bones, which is the bone cortex, is seen here hypointense. Is seen here dark on MRI. That's because this structure has immobile proteins. So they do not resonate on MRI images, so they look very dark. But what is inside here and what looks hypodense on CT is seen very hyperdense on MRI. This is the bone marrow. And the bone marrow in human body is mainly two types, the red and yellow, right? The red is more responsible for the production of blood cells, and it is more in children. But once we grow, it becomes less. But the yellow marrow then occupy this space. The yellow marrow has more fat than the red marrow. The red marrow has about 40% of fat, but yellow marrow has 80%. That's why in adults, when we look at the bone marrow, it seems very bright. That's why we see these structures very bright. The teeth, which are very dense, are seen very dark. So this is important to compare. Another thing is the subcutaneous tissue. The subcutaneous tissue, because it contains fat, subcutaneous fat is seen very bright on MR images. It's more on T1 than in T2, but on CT it is dark. It's seen dark or hypodense. Although it's not as hypo as the air, but it's hypodense. And then for CT images we have the CT value, which helps us to identify what kind of structure is this. Is it bony? Is it calcified? Is it hemorrhage? Is it soft tissue? Is it fluid, fat, or air? But on MRI we just have the signal.
So, for the subcutaneous one, you said it's different on CT and MRI, but we are now T1 and T2. We also have some differences.
Okay.
So please explain that.
We have some T2 MR images. When we reach them, we will see this difference. But by the way, this is a bony window, so we don't see the soft tissue very clearly, as you see. What we see here is just the bony structures. The others are very subtle. The only thing that is like dark on both on this image is the air, right? Let's come back to this image. This is MRI. So this is the cortex of the body of mandible, and these small hypointense areas are the teeth, which are very dense. This is the marrow of body of mandible, and this is the floor of the mouth, soft tissue. This is at the level of mandible. This is more cephalad. So here we can see the cartilaginous part of the nasal septum, which forms the anterior portion of the nasal septum. This is the inferior nasal concha. The bright part is the marrow, and the dark part is the cortex of the bone. Same thing with the other bony structures. This is the petrous bone because it's very dense, so it seems very dark. This is the condylar process of the mandible, mandibular condyle, which articulate with the temporal bone. As we see here, the edges are dark, right? Yeah, which is the cortex here, while the bone marrow is bright. This is sagittal T1 MR image. The clivus marrow is very bright. This is a portion of C1 vertebra, anterior and posterior arch. So we can see the cortex dark and the bone marrow bright. Another thing to notice here is not to confuse subcutaneous tissue, which is hyper intense on MRI, with the hyperdense structure which is seen on CT, which is the skull, right? Yeah. So here what we see hyperintense is the subcutaneous fat tissue, but the skull is still inside. This is the outer table, dark. Then the bone marrow, slightly bright, iso, or sometimes it's hyper in some areas, and then the inner dark again. So we have these three layers for the skull. This is the bastion, which is the lower edge of the clivus, and this is the opistheon, which is the lower edge of occipital bone. We can see the other structures here. This is the hard palate. This is the tongue, the teeth, very dark, body of mandible, the cortex is dark, and the bone marrow is bright. And the other structures, we already covered them on CT. Another image. We can see the maxillary sinus, which contains air, so it's dark on both CT and MRI. This is a coronal section. Here we can see the zygomatic process of the frontal bone. The frontal bone, because this is more anterior section. Cristagalli, if you notice here, the cortex is dark and the bone marrow is bright. So be sure that you do not confuse these structures, like the fat of the bone marrow, with the other fatty structures of the body. What we see here is the retrobulbar fat, the fat within the orbit. And these are the muscles. When we talk about the orbit, we will talk about these muscles. This is the maxillary sinus, palatine process of maxilla. As you see here, they join each other at the midline. So they are more clear here than on CT. On CT, we cannot see this cut. But here, because we have cortex and marrow, the cortex is more dense, it's more dark. So here we can see where they join each other. These are the teeth, and this is the body of mandible. This is a more posterior section. This is the brain, frontal bone, and the zygoma, which is the zygomatic bone. This is the body of mandible, and these are the teeth. This is the palatine process of maxilla. I think this is enough for today. Then later on we'll talk about the orbit, the ear, temporomandibular joint, and other structures of the head and neck. Thank you.